Now the cough patterns and associated with the TCM disharmonies. The dry cough is there. You try to see what could be the reason. When the dryness is there, excessive dryness or the fire accumulated inside the lungs. People says I have the dry cough. Dry cough is getting not from the bottom of the lungs. It is slightly throat, trachea, bronchi, not the bronchioles. From there it's getting the problem. In that condition, the TCM says the excessive dryness. Where is excessive dryness? Two ways you remember. Once the lungs having the excessive dryness, the other one is the heart having the excessive dryness, or the lungs having the excessive heat, or the heart having the excessive heat. That means is the yang get excessiveness in the lungs, yang get excessiveness in the heart, reason to cause the dry cough. When you recognize when the yang get excessiveness, what is deficiency? Yin is deficiency, isn't it? When the yin having the deficiency, yang is excess. Yang is nothing but is the fire excess. That means what is deficiency? Cold is required. Cold is yin or yang? Yin. That means yin is deficiency. That's the reason where the body fluids are not enough in the lungs could be the reason to cause that problem. For example, some of the patients, I think you take it to Ajmal, dryness, little more dryness. Maybe he drink water, maybe he take less water comparatively. The body having the dryness, that reflect on the lungs dryness as well. Overall moisturizing, that's the reason what I told you, minimum how many liters of the water to be taken? Yeah, 2 to 3 liters at least we should take it. I think that would be better to regulate. How you wanted to know whether you are taking the normal water, enough water, or you are not taking the enough water? Yes, by looking the skin. That is a hydration, pinching of the skin. That is for the dehydration we used to see. Whatever you are eating and then drinking, okay, you are using. When you pass the urine, that time you try to see, not the medicine, who take the medicines, the color also goes in that, but I'm not talking about that. But normally the people who don't take the medicine, for them cross-check whether your urine is passing like a white color or yellow color. Slightly yellow, that urine having the opacity of that slightly yellow. But you recognize that heart, even you ask them, how are you passing your stools? Then how are you passing about your urination? Your urination flow is good, and also you are passing is the very clear urine, or maybe you have the yellow coloration. They will tell you. Even the Hakims, the ancient time, they used to see the urine and then recognize the diseases. Even today, some of the doctors, especially the Arabic doctors or maybe the Unani doctors, Hakims, for them we say as a Hakim. So they keep it that urine have to place it in front of the Hakim, then he prescribe the medicines. To recognize that level they are have the. That's the reason even today urine analysis test also is existing. You know that. What are the pus cells? What are the epithelial cells? What are the white blood cells? What are the red blood cells? What are the yeast and fungus and fungi and pus cells? So all come to know through the urine. But by looking itself, we can recognize what exactly. That is the microscopy, but this is as a macroscopy. We see that is the macro, right? So in that way, he recognized and he prescribed. I mean to say, the excessive heat is there in the lungs. They pass the urine also slightly low. You cross-check with them. This also there is a diagnosis, urine diagnosis. You ask them, every patient, when you deal and treat to the patients, you just ask one question, how are you passing your urine? And then you will come to know. Now the fire accumulation inside the lungs. Fire is accumulation, it's burning. Then what is required? What is required? Cold is required. Cold is how we can take it as a cold. Very good. But water, I mean to say water we consume. Water itself is a remedy. You consume sip by sip. It's not that I'm really thirsty. 1 liter of the bottle, he put it into the mouth. The whole in one sip, he completed the 1 liter, he thrown the bottle. I have seen in my naked eyes. Such a thirst. But that is wrong. He's standing and styly he is drinking with the left hand, and then he put it the entire whole, and also his stomach is dampness. That's the reason you shouldn't do like that. That is not good. Still, a lot of time it will take unnecessary. Then what is the solution for that? I'll tell you the treatment protocol as well, so that you have that idea as well. Now, excessive dryness, then the fire. Here you need to recognize the treatment protocol. You just use the 2 points. Number 1 is Lingdao Qianxi and then Chinchu. One is the LU8 sedation, P5 sedation, H4 sedation. Then one more point, you just keep it in the mind, as you rightly said, LU5. LU5 tonification. But this is the sun point. You need to sedate. But what you should do here? Tonify here. This you may not accept easily, but when you are in dilemma, apply perpendicular. Don't worry. LU5, you just apply. But to understand to the gravity level, but it takes longer time to understand. So many concepts are there. But however, you recognize this, is that you got idea? Then may not be required many points you need to do. But still, as a overall, based on the principle of the filament theory, I'll tell you. Then later, as a summary of this entire respiratory system, what to be done? I think by using only the 2 to 3 points, I'll tell you. Only those points are enough to treat all the respiratory system related disorders. Do you require that? Then I'll tell you now, finish the matter and then go. Why you wanted to listen till 5 o'clock, right? So however, because you know this, then only you can recognize all those things. But still subtle ways is there, shortcut ways are there, but still theoretically you try to understand. Now the productive cough with the white and thin mucus as well as the runny nose. Now you can understand external wind and coldness attack. Invasion means attacking, right? The productive cough means what kind of the cough? Yes. Phlegm cough, mucus cough, right? So when they cough now, that time even normally I do in our clinical practice, then I ask them, I hold here head, then I ask them to put it down. Abhi can't, so you just cough it now. You cough it. When I ask them to cough, we recognize what kind of the cough, isn't it? So we don't want anything like a big theory is required. So take a stethoscope and then put it the chest piece on this chest region, then to recognize lambi sans liyo, not required. All are to making the big money, right? For to check up 1,000 rupees, you keep it as the chest piece and then you will get 1,000 rupees as a consultation fees. But it's my clinical experience, but they are not telling they are the wrong or good. But however, you recognize. For example, if I wanted to gain the money every day, for the commission, I hope so I may get 10,000 commission. Minimum 10 to 20,000 I can get the commission from the hospitals, from the laboratories. I can get that. Even I used to see only the locomotor disorders. Every patient is MRI, every patient is CT scan, every patient is X-ray. I'll get half of the money to my packet. But I never done. People ask me, I need to do. Then I tell that, see, I recognize your problem. Then why you wanted to do that? What you are spending money, you spend here, not now, but until you complete the treatment, then you will be benefited. If you bring that also same treatment, if you don't bring, I recognize it now already, but why I wanted to get into that. So likewise, but still lot of things are there, but you recognize that productive cough, easily we recognize that. X-ray is not required. And yeah, of course, the serious problem is there, he is not getting relief by any modality of the treatment. Then definitely I'll ask them to do it on the same day. Even yesterday one patient came to me, and yesterday she went to 4 days trip outside. She had Tirumala, she went, and 4 days she had the food in outside, and then swollen, all the legs are swollen, abdominal got swollen, facial got swollen. Then I recognized, and anemia, the hemoglobin is, iron is less. Then I asked them to do immediately the renal test. But I want to know that. But to exactly, and if I don't do it, somebody will do it. Then they shouldn't blame to me. You have treated, doctor, you never told me I have the kidney problem. I'm treating, but kidney problem is not super simple. Immediately you can do it. But at least they feel that doctor साहब ने पहचाने बीमारी क्या है. So at least they feel that कि हाँ इन्होंने बोला. Even after seeing that, I don't tell them kidney problem is there, you go. But certain things, all the clinical practices slowly will come to you, but gently and diplomatically you have to handle everything. No, otherwise will be the practice will be very difficult. You don't understand the patient psychology, but you cannot achieve the good practice, right? In that way, now you recognize that productive cough is there. When they cough and they are talking, I recognize you have the productive cough. Then in that case, external wind and then coldness got attacked. Now tell me, what are the organs are affected here? Wind and then coldness. What are the organs? Good. Liver and kidney is affected, right? This is the two principle, you keep it in the mind. When I talk the extraordinary level, now I talk something extra information. Now wind and coldness is affected. Rather than selecting the liver and kidney, but I wanted to use on the lungs point itself. Now which is the wind point of the lung, which is the coldness point of the lungs? Yes, LU5. Very good. LU11 and LU5. Very good. I'm very happy you people are giving the answer. My dedication is fruitful. So you treat by, now you can use the liver 4 or you can use the K7. So both the points, or you can use the liver 1 sedation, or you can use the K10 sedation also. K10, the formula you keep it in the mind forever, because you recognize अलग अलग तरीके से हमें समझना है. When we understand, my किताब में लिख दिया, if I have written on my book, you are following the same, it's not good. But what is written on the book, perhaps that also something different. But now what I am telling, this particular moment, what Almighty God is giving the knowledge to me to express you, that I am giving you. But you understand that so many ways you can understand. The 3 protocol I will try to give you now, all are correct, and then you can implement whichever. I mean to say, आप concept को समझ लो, then you do it. लेकिन शिफा देने वाला वो है, मगर एक satisfaction किससे होता है? For you should get satisfaction. तो मैंने प्रॉपर एनालाइज किया, प्रॉपर मैंने काम कर दिया, और मैंने प्रिवेंशन के लिए बता दिया, और क्या करना चाहिए वो भी बता दिया. उसके बावजूद वो ठीक नहीं हो रहा है, तो फिर देयर आर द मेनी रीजंस. लेकिन हमारी भी गलती हो सकती है. वी ऑल्सो डज ए मिस्टेक. एनालिसिस इज नॉट करेक्ट, राइट? द ट्रीटमेंट यू सेलेक्टेड, द पॉइंट इज नॉट करेक्ट. Maybe they are not taken care of themselves. Many reasons. However, now you recognize protocol, you just write down external wind and coldness invasion. But don't think about only the cough. But anything it may happen. Wind and coldness is affected to anything, anywhere in the body. So now wind. Wind means liver 1 sedation. Then K10 sedation. 2 formula, right? K10 in kidney ka horary point, you sedated. Liver 1 horary point, you sedated. Now you wanted to connect this wind and coldness communicating point. Wind or coldness ka connecting point, यानी wood and then water. Wood and water connecting point is K1 or the liver 8. K1 or the liver 8 you can use it. The third protocol. You can use the LU11. You can use the LU5 as well. This one protocol. Right. LU11 I told you, LU11 and then LU5. So in this way, try to analyze and then keep it in the mind, but definitely that have the positive impact. The patient was the productive cough is there, that can be dispelling to be taken place. Now the another concept you keep it in the mind, the cough is produced, the phlegm is produced by the which organ? Very good, wonderful. Spleen. Then you minimize the spleen. Spleen को क्या करना? Sedate करो. Spleen is producing the lot of phlegm. Then use the 1 point that to be known as a stomach 40, that is the Feng Lung point. Stomach 40 is the good point to treat for the productive cough conditions, isn't it? Then bleed that point if it is possible, or you can do the moxa. Rather than bleeding, moxibustion is always is good on the stomach 40 and also LU5 and then LU11. Patient will be benefited a lot. Then the third category of the cough that easily produces a sputum, excessive coldness, dampness, phlegm accumulation inside the lungs. This also what you should do, which is the spleen. Spleen is excessive function. How to control the spleen? Spleen controlled by which element? Which organ? Very good. Liver is overacting on the spleen. Liver is overacting on the spleen. That's the reason spleen is producing. Then what need to be done? Reduce the liver energy to regulate the spleen. How amazing! आपको एक टेस्ट आता है, एक मजा आता है, एक बिरयानी का टेस्ट जैसा है, तो वैसा आपको फील करना. लंग्स इज समवेयर. लंग्स प्रॉब्लम को ट्रीटमेंट करने के लिए लिवर को सेडेट करो. दैट इज द ब्यूटी. समझ में आ रहा है? रूट कॉज कहां पे है? Treat for the liver, sedate liver. Liver is controlling to the spleen, but liver is over controlling to the spleen. That's the reason it's producing the excessive phlegm accumulation in the lungs. So that need to be minimized by sedating the liver. Liver one को sedate कर दिया आपने. Further, you wanted to do the one more technique. The technique to be known as a spleen itself you sedate. Spleen itself you sedate. That means thigh pie. Spleen 3 you sedate spleen 3. Which is the mother for the spleen? Mother for the spleen is heart. Good. Heart, isn't it? Superior organ. Then heart is producing the lot of phlegm as well. Heart is creating to the spleen. So take care the heart having the good function. When the chest having dysfunction, then treat to the heart by using the tungli, that is the H5 point you treat as a luvo connecting point to regulate the chest as well. Because the lungs, you remember, there is the asthma or the productive cough is not related only to the lungs, but also it is related to the heart. Heart also manifestation to be taken place. That's the reason we try to connect to the, when we try to understand heart having the malfunction, connect to the heart by using any one single point, the luo connecting point, or something else as a fire point you wanted to use it. H8. H8 you just apply the needle. That means the fire regulating point. Because if the fire is elevated, normal level, the cold will get suppressed. The sputum gets suppressed. In that way also we can do it. Then cough with the yellowish sticky sputum and difficulty to expel. Cough with yellow sticky sputum and difficulty to expel. The lungs are overheated. White mucus is the coldness. White sputum, coldness. Yellow sputum, heat get excessiveness. Where is heat get excessiveness? In the lungs. When the lungs having the overheated, then how to destroy that? What is the treatment protocol if the lungs are overheated? What is excess? Yang is excess, but in is deficiency in the lungs. Yang is excess. That means the fire point of the yang is excess. That means the LU10 excessively functioning over there. What need to be done? Sedate to the LU10 point. Then what is required? In get excessiveness. In get excessiveness, what is required? Water point is required. Water point to be known as a LU5 point is required. So therefore LU10 and then LU5. LU5 is the tonification. LU10 is the sedation to be given to the patient to get the maximum recovery. Then further, what is advisable? Ask them to consume the water. When there is the heat is coming, when you touches to the body or the lung meridian, the hotness is there. Suppress with the taking the lot of nutrition related to the cold constitution of the food. Then further hyperactivity of the liver and gallbladder, which I told you. The weak cough with the feeble breathing or the shortness of breath. The lungs having the deficiency, lungs chi get deficiency, also could be the reason to cause the problem of the cough. As I told you, simple slight cough is there. Small amount of the reflux is happening. Sometimes he'll get repeatedly, he will do it. And also the patient feel low energy, lethargy, malaise. In that condition, the lungs energy having the deficiency. What are the points you need to activate for the lungs? Very good. Good. Right. All 3 points can be activated. So however, LU9 point you just activate. LU9 is always is good when the lungs chi is deficiency. And the lung 1 point, that means the first point, to strengthen the lungs chi. Right, to strengthen this point, to strengthen REN 17 and then strengthen the LU9 point always is good. So it's not for today, but down the line for the span of maybe 10 days, you just activate these points, but definitely slowly the lungs chi get developed, isn't it? But you cannot do in 1 or 2 sittings, it takes time. but continuously ask them to activate. That have the positive results, and the people will be benefited where the lungs chi get be activated. The cough better in summer, worse in the winter, cold and windy weather. Excess coldness or the yang deficiency. So a cough better in the summer and worse in the winter. So excess coldness or the yang deficiency. Do you know excess coldness? Cold means is the in excess. Then obviously yang get deficiency. The cold excess, that means what to be done. Again, it is repeatedly you come case LU5, coldness get excessiveness. Then the yang is deficiency, fire is deficiency. Activate the LU10 fire point, increase the energy. So all these are energy converting points, energy changing points, transporting points. The chi is moving from one organ to the another organ. So in that way it's happening. Cough mostly before the noon, before 12 o'clock, the cough will get. So what could be the reason? Fire in the stomach, it causes the problem. Fire in the stomach, it causes the problem. What need to be done? One single point, you just do it. You do the wet cupping therapy on the Feng Lung point, that is the stomach 40. Where is stomach 40 is located? 5 chun distal to the stomach 36. 2 finger breadth lateral to the border of the tibial tibia. Right. On the ATM muscles, anterior tibialis muscles. So you just use that stomach 40, definitely have the positive impact. But certain stomach 40 point, we need to do the moxibustion. But sometimes what we should do? Sometimes we should do the bleeding as well. Hope you are understanding. That means the cough mostly before noon. You just check with them, is that do you have the fire or burning sensation on the epigastric region? If they say yes, I do have, immediately you just do it. Stomach 40, you just bleed. Cough mostly in the afternoon. Afternoon is the yang is get excessiveness, but in having the deficiency, what to be done? Excessive fire is there. Reduce the fire and increase the coldness. In that way, we can do it the treatment. But however, you can do it as a few points by using the in deficiency. By using the LU9 point, you just use it. Any deficiency of the lungs, then in deficiency or the in get excessiveness, any condition you keep it in the mind. LU9 is always is good to treat for the pulmonary system related disorders. Cough mostly in the evening. Evening means indeficiency leading to the virtual fire or the kidney indeficiency. Evening will get the problem. Evening is which organ? That means is the lung, kidneys. Evening is 5 to 7, right? Then again 7 to 9 is the pericardium. 9 to 11 is the triple warmer. Likewise, when we understand about the evening time getting the cough, then what to be done? Activate to the kidney. Which point do you select? Very good point. So morning, you can use this K7 point. So K7 point is always is good. K7, along with that, you just activate the K6 point. Remember, whenever you have the problem related to the cough and then congestion, it's a very much essential to activate. What need to be activated? Why I mean to say K6 is very important. Do you know LU7 and then K6 is the combination, which is connecting the confluential point for the throat and also Renmai meridian, in Chiomai meridian as well.